The coronavirus crisis has brought serious distress to local economies and advertising along with them. The New York Amsterdam News has partnered with the local media association during this unprecedented crisis. Help us continue our important work of chronicling the life of blacks in New York and consider making a donation to the COVID-19 Local News Fund. Go to givebutter.com/Amsterdam News to donate. It's Monday, April 13th, and welcome to the New York Amsterdam News Podcast. I'm Cyril Josh Barker. We continue our coverage of the COVID-19 outbreak with my guest, Assemblyman Charles Barron, and Councilwoman Inez Barron. Amsterdam News editor Nayaba Arinde will join me as we talk with them about the coronavirus and its impact on the black community. Last month, Brooklyn Assemblyman Charles Barron tested positive for the coronavirus, and soon after, his wife, Councilwoman Inez Barron, also tested positive. Charles spent time in the intensive care unit and also had pneumonia. Inez was later diagnosed but was asymptomatic. The political couple is now telling black New Yorkers to be careful and take precautions as COVID-19 hits the black community hard. And we welcome you to today's episode of our podcast. So sorry about last Thursday. We had a guest, but they canceled, so I'm sorry about that. But we're back now, and we're going to be doing continuing through the week. I usually hate to skip episodes, but it does happen sometimes. But we're going to be on it, so no problem. We're going to have that guest come back, and we'll let you know when that time comes. This show actually takes a personal impact for me because I do know Charles and Inez Barron personally. I've known them for years since I've been at the New York Amsterdam News, and I'm so happy that they're here to discuss with us their situation, how they battled COVID-19, how they dealt with it, and now they're telling the community to be vigilant, to be knowledgeable about what's going on and to stay safe. So we definitely are so happy and pleased to have them on. And one thing I wanted to do, I didn't get a chance to do this yet, and I'm going to do it now, and that is I just want to give a big thank you to all of the healthcare workers that are out there who are on the front lines, all those essential workers who are still making our city run. I think that the work that they're doing is just so amazing. So I just want to give them, from me, a very heartfelt thank you to all the healthcare workers. I know we have a lot of folks that are listening to the podcast. I'm pretty sure we've got some healthcare workers. One of the things I have to mention this week, one of our top stories is going to be covering education. I'm sure you've seen the Mayor de Blasio and Governor Cuomo have kind of been doing a tug of war when it comes to the closing of the schools at the expense of young people. And Inez Barron, Councilwoman Inez Barron, I think is going to be discussing about that and what it's doing to our children. There's still a large number of children who do not have the necessary tools they need to be able to learn remotely. So we're definitely going to be speaking with her about that. One quick announcement I definitely have to make is that the podcast is now on Google Podcast. I'm so excited about this. So you can find us on there. You can download. You can, if you don't have Google Podcasts, rather, you can download the app and you can find us there. Just put in New York Amsterdam News Podcast or Amsterdam News and you'll see us right there. So just want to let people know about that. Still working on some other platforms, and we'll definitely let you know as we build our repertoire of different platforms that we're going to be on, trying to get on a few other ones, and so we'll just let you know when that happens. Well, my guests today are Assemblyman Charles Barron and Councilwoman Inez Barron, who are going to be speaking with me about their own battle with COVID-19. I'm being joined by Amsterdam News editor, my boss, Nayaba Arinde. Welcome to the podcast, everyone. How are you doing?
Well, thank you.
Good, thank you so much.
Very well, thanks.
Good. Nayaba, first thing I want to do is actually I want you to talk to to the readers out there who are listening to the podcast. They've been faithful listening to it for several weeks now as we go through this process. Any words that you have to say about what's going on with the paper, how we're doing, just please go ahead and say whatever you like.
Okay, so we're 110 years old, going into our 111th year at the Amsterdam News. And we are very grateful and thankful that our readers have stood by us in cycles, of course, over the different generations. And we're trying to maintain that strong level of support, being on the street, having our ear to the ground, speaking to the folks on the street, on the ground, and also those in government, local, national, and international. We want to maintain that. And with that said, we want to thank our readership who've been loyal, especially during this time of the COVID crisis, because it's difficult for everybody. Mm-hmm. Folks have got a million things they could be doing other than reading any newspaper, but we are thankful that people have stood with us, and we want you to do so and know that we're trying our very, very best to bring you the best coverage as we go through this particular crisis. So thank you.
All right. Thank you so much. All right. Assemblyman Barron, I definitely want you to take a moment to tell us about your experience with COVID-19. You are still recovering. Take us through what happened exactly and what your experience was.
Well, about March 5th, I returned from Albany and a little feverish. So I called my doctor, and he said, well, why don't you just, take some Tylenol, bring the fever down. And so I did a couple of things on that Friday, did something else on Saturday. But when I kept feeling so weak, I decided with this thing going around, let me quarantine myself. And so that Sunday, I decided to stay home. And then I noticed by Thursday that I had shortness of breath. So we decided to go ahead to Brookdale. I called my primary care physician at Brookdale and said I was coming to be checked out. When I got there, I was the first one diagnosed with the COVID at Brookdale. But when I got there, they said, with your symptoms, we need to admit you. So they admitted me, and they found out that I actually had pneumonia plus shortness of breath, and they gave me oxygen, and they kept me in an isolated area. Mm-hmm. Then I was tested for the COVID virus, and on that Thursday, and then that Saturday, they said I had it. Mm-hmm. And I said, oh, my God. Needless to say, I was rocked, but it took me minutes to collect myself with my queen sitting right there. We said, all right, let's rumble. The doctor said, but don't worry, you're not going to die. What do you mean I'm not going to die? That never crossed my mind. I'm talking about getting out of here and being fully back to, where I was. But it was really, really tough. Matter of fact, it got to the point where they came up one day and they said, you know what, just for precaution's sake, we're going to take it out to ICU, the intensive care unit. I said, oh, that's not a good sound.
Right.
So when I got down there, they took x-rays and they said it was getting even worse. So I just believed God. I just didn't believe God was finished with me doing the work that I need to do on earth. And no matter what any doctors said, no matter what any test showed, I believed that I was coming out of there and eventually being back to full health. So after a while, they stabilized all of signs or vital signs and put me back up in the room in isolation. Then after a while, they had me on oxygen, and they said, you know what, there's nothing else we could do. So I said, well, why don't you take me off the oxygen and see how well I could breathe on my own. They wanted me up to 95, 96 in terms of oxygen percentage. That's normal and good. I was at like 92. Came and got me. Man, I tell you, God is in this house, and God is definitely with my wife. She sent out her prayer warriors. When I got in this house, it was like a whole new strength came over me. I was walking on my own. I was doing exercise, and my eating, my appetite came back. And we have, and I want to suggest to our listeners that if you can get this in your home, we have like 4 kits that monitor the importance around this virus. One is a oxygen monitor, and it also monitors your pulse. You put it on your finger, and it'll let you know where you're at. I'm now at 95 and 96 every day on my own. That's big. 2, I have a thermometer to take my temperature every day, and my temperature has been like 98.1, which is excellent.
Okay. Wonderful.
And I take my blood pressure, so I'm like 110 over 70, and sometimes 107 over 68, excellent. And then we have this glucose monitor, and we want to monitor my sugar because I don't want to overdo it with the sugar. You know, I'm at 6.1. Diabetes is 7 point and over. So I want my sugar count to stay down, and if I want it down, And now I've been monitoring it, and I've been like 107, 100.
Okay.
So my sugar count I'm monitoring, which puts me in a good shape. So those are my vital signs now. I'm a little congested in my nose and my chest just a little bit. I got to learn how to breathe deep when I talk. My wife always reminds me, this is what I just did. I just brought it down as I'm talking up in my chest.
Mm-hmm.
So I'm doing sent back. Inez was strong all the while, but I'll let her tell it herself.
Okay.
Ms. Inez, can we ask you, how was this whole process for you? Because you obviously were there from the very, very beginning, and monitoring your husband. I'm coming to find that you also contracted the COVID. So please tell our listeners how that was for you, the whole process.
Thank you so much. Greetings to be on your program, Josh, and to share this time with my friends. This is a very serious disease. I did not have any of the usual so-called symptoms from this COVID. In retrospect, I realized that, well, maybe a week before all of this exploded, I did have some achiness in my arms. And when I was going up the steps to get to the train, I did have to stop at that thing. But I just said, oh, well, Inez, you are actually getting older. But those are just some mild passing things that I had that I did not pay attention to at the time that they occurred. But in retrospect, that might have been some of the manifestations of this disease. But other than that, I did not have any manifestations. I didn't have a fever. I didn't have chills. I didn't have temperature. I didn't have weakness, because Charles was extremely. So all of those symptoms I did not have. So once the doctor told Charles the test had come back positive, I said to the doctor, well, doctor, do I need to get tested? He said, no. He said, I've watched you. You don't have any of the symptoms, but you probably do have the virus, but you don't need to get tested because if you come back positive, it'll be the same course of action that you'll take as I'm telling you to take now, which is to stay isolated for 14 days. But we decided that I would take the test so that we could share the information for so many reasons, to know that there wouldn't have to be something that people would need to hide if in fact it came back positive.
Right.
So we took the test and it came back positive. And as I said, there was nothing different after the test results than what I had been doing prior to the test results, which was drinking a lot of fluids, monitoring my temperature, getting a lot of rest, getting a lot of vitamin C, and, just keeping myself calm and monitored. So the course of action was the same before my results as it was after the results. So I was able to really try to address Charles's needs in terms of encouraging him, which he doesn't need much encouragement, you can imagine, but helping him regain his stress, giving him some really attractive meals, nothing elaborate, but simply making sure that it was palatable, looked nice on the plate. It was something that he liked to eat. And have to, first of all, go back to what Charles said. The prayers of the people regarding our health. We could feel it. Yeah, there are a certain group of people. There's a half a dozen folks that I call when I say, listen, this is a serious issue. I need you to help me storm the gates of heaven. So I reached out to my prayer group immediately. But just generally the thousands upon thousands of pastors who mentioned us from their congregations, because at that time churches were still meeting, right. The prayers that were offered on behalf, well wishes from those of our colleagues who have another kind of faith-based or lack thereof, whatever you want to call it, who sent their well wishes and support, the outreach that went up on our behalf. It was just amazing. And we can literally feel it, the vibration. We can literally feel it. So we give all praises to God. We give him all the glory. We're victorious in this instance, and we're looking to continue to do a great work that we've been called to do on behalf of our people.
All right. Wonderful.
You said, Ms. Inez, you have not been outside of your house for 14 days. How has that been for you in terms of not stepping out into the street and mingling with your constituents and your neighbors and all of that, and just walking the street? How have you managed to stay indoors and stay sane and just, positive?
it's very interesting. Like I said, we self-isolated for 14 days, and then even beyond that, for about 21 days, we did stay in. And then after about maybe, because we've been in for more than 31 days ourselves. Wow. So one day this past week, we did go out, put on our masks, put on our gloves, and we sat outside for a few minutes on our little porch in front of our house. We did that for about 15 minutes. But that was the only time we've been. People have been gracious enough, orange juice of that nature, and we go get that or the mail, but other than that, we've been in the house. So we realize that we're very blessed. There's so many people who are living in conditions that don't allow them to have, breathing room or go in a separate room because at the same time that we were self-isolating, we were even isolating ourselves from each other. So that was an ability that we had because, as I said, God has blessed us, and we do have the space to be able to be in separate rooms and not be on top of each other and have separate quarters that we can address ourselves. But I said to Charles, I feel very concerned about people who are in situations where the tension between the partners sometimes can get very physical. Right. I feel very sorry and concerned about those parents who have their loving children with them 24/7. I mean, we love our children, we really do. Right. But to be with them 24/7, confined in however big your house is really a challenge on your nerves, on your patience, on your creativity, and on your ability to continue to express positive love for your children. So we're concerned about those persons who are in those kinds of situations. But I said to Charles, it's a good thing we like each other. It's a good thing we're in love. It's a good thing that we have the ability to have thought about things that share that experience. And once again, we get what we ask for, so be careful what you ask for because you may get it. And I asked God, please send my husband back, let him be safe. So why would I turn that blessing back, and why would I not want to be supportive of him in all those ways? So yes, we're very blessed. We're very blessed.
All right.
Can I ask you real quick?
Go ahead.
One quick question. What kind of questions are you getting, particularly in terms of what they need from the office, even though most things are closed down? What are they asking you to help them with in particular?
It's been the same issues that we generally have. As you indicated, my staff is working remotely. All of the calls coming into our office have been forwarded to their individual lines based on what their issues are. Mainly they've been issues of applying for benefits and the unbelievable wait time that they're facing. If they're applying for unemployment or for HRA benefits, the system is swamped. It wasn't designed to accommodate the thousands and tens of thousands of people who are using them. The line has crashed several times and tried to work on that. The city lines have crashed, and they're trying to work on that. Someone told us that they literally were on the phone with someone, waiting on the phone to be serviced for more than 2 hours.
Oh, wow.
And it's just horrendous. Yes, more than 2 hours calling in about unemployment benefits. The system is swamped, not just with numbers of people who are calling in, but many of the workforce are not there because they themselves are ill. So we're trying to ask people, call as early as you can and be patient. Don't hang up, don't call back. If they put you on hold, just continue to wait. And the other thing that my office has done is what Charles has said. We'll make sure that we bring the issues to the front, to the attention of those who have the decision-making power, namely Mayor de Blasio and Governor Cuomo. So we're offering information about parking lots that are large enough to serve as mobile drive-through testing sites. And we're also offering information about locations that might serve as a walk-up testing site as well. And other ideas that are being floated, such who have been diagnosed with COVID-19, but who don't have the luxury of going home and isolating because they're in overcrowded conditions and they're getting a separate room may mean that 2, 3, 4 other people are in one bedroom or in the living room or sleeping on pallets on the floor. So we're looking at the idea of establishing a temporary location where those folks can go for the 14 days when they're in isolation.
Okay.
Also,
sorry, go ahead.
we've been also talking to people about stop putting a great amount of emphasis, and I know it's important, on the data to show that we are affected worse. You know, de Blasio and Cuomo over the years have passed budgets that didn't address our healthcare needs, as a matter of fact, cut stuff, and didn't address our poverty. Of course we are affected more. He said 34% of the deaths are Latinos, and they're 29% of the population. 28% of the deaths are blacks, and we're 22% of the population. And yet, even though whites are 34% of the population, their death rate is 27%, and Asians are 14% of the population, and their death rate is 7%. It is much higher than that. He's talking information from HHC hospitals. Most of the hospitals are voluntary hospitals. Brookdale is not HHC. Interfaith Medical Center is not HHC, and much of them aren't. And then even those statistics are based on 63% of the information being in. We're at 40 and 50%, I'm certain. Just as Chicago, 68% of the deaths are black, and they're only 30% of the population. And the same thing in Louisiana, Milwaukee, all saying that lay them for the statistics right now. Send in the aid. Send in more testing. Okay. We need more masks and gloves. We need more ventilators. We need more staffing for our hospitals. And just like you brought a boat to Manhattan and all that other stuff, and you brought a Central Park into all these other places, do it in the hood. We got space. Bring that same kind of attention and resources to our communities. And then I also want to say that I couldn't criticize and be more angry at my colleagues in the state assembly and in the state senate, and particularly the two leaders, Carl Hastie and Andrea Stewart Cousins. How dare you? That's a budget that has $2.5 billion cut in Medicaid, that has a rollback of the no cash bail, so that more of us are going to go to jail now. And that is not a place to be. This is before even convicted. How dare you let him cut $300 million from the hospital and then give him the power to say he can make cuts without going to the legislators. So this is incredible. And then you pass a budget that said we're not going to tax the rich, when we could have gotten $35 billion by taxing those who can afford to pay it. A pied-à-terre tax on those $10, $20 million mansions that billionaires have that don't even live in the country. Stock transfer tax, a few cents they tax them on transfer and stock. It adds up to $13 billion. And guess what? They rebate the whole $13 billion back to Wall Street. Inez was fighting for this when she was up in the state assembly. She said, well, at least give half, $7 billion for us and $6 for y'all, and we can close the gap. And then there's a wealth tax on those who are extremely wealthy, get $4 billion. 5 and 10 million. That's a total of $35 billion. Cut that in half and say we didn't get it all. We get $15 billion. We have a surplus. And you said increase education money and increase Medicaid money. You don't take it away. And the way they do it, he set up a Medicaid design team, put some blacks on it to create savings. That's the same language Trump used when he cut Medicare on the federal level. He said, I'm not cutting it. I'm creating savings and cutting out waste. There's no more waste than the Pentagon budget spending $7,000 for a coffee maker. So don't ever have elected officials go back to office after they voted for a budget that did all of that. Some of them complained about NYCHA. Well, in our capital budget, no money for NYCHA. School is flat, which means they're not raising it, even though the cost of everything is up. So if you got $1,000 for your school, they're going to give you the $1,000 again, even though everything you going for is $1,500 now. So you got to come out of your pocket. This was the worst budget ever. I have to give credit to some of our black elected officials who voted no. 17 of us voted no. I was able to vote from home. 17 voted no. We were 5 votes short of defeating this budget. Shame on them.
Wow.
One of the things that I wanted to ask real quickly, Assemblyman Barron, is a lot of people are saying that COVID-19 is exposing a lot of things that a lot of people didn't know about before that are affecting the black community, which are now in turn having an impact on how COVID-19 is affecting us. What is your reaction to that? Because one of the things I keep seeing is, the reason why so many black folks have it is because we're the ones who can't work from home, or all these other different things. Can you elaborate a little bit more on that?
First of all, we live in a racist, parasitic, predatory, exploitative, capitalist system that has a warmongering, imperialistic foreign policy that is devastating countries, Africa and the Caribbean and Asia. And in our communities, since we've been here, we've been economically oppressed by capitalism, and we've been socially, culturally oppressed. So what happens in crises, for those who are poorest and most oppressed, you're going to experience the brunt of the death and the brunt of the injuries when anything happens. So we didn't need COVID to let us know that prior to COVID, we had the highest rates of asthma. High blood pressure, hypertension, heart diseases. We had the highest rates of diabetes, and we had the worst healthcare delivery system in our communities. This has been happening ever since we've been here. Mm-hmm. So when we go to people and say, come on, y'all need to get down in this movement, we need a revolution. We need a radical systemic change. But in the meantime, black elected officials, particularly in the state assembly and senate and the city council seats, no matter what happens in the presidential elections, people say, we got to stop Trump. We got to stop Trump. Like we're living so great before Trump. Mm-hmm. Yeah, you got to stop Trump. He's the worst thing that ever happened to the world. But when you stop Trump and you get Biden, you're not going to be doing a whole lot better. And I challenge anybody to look at Bush's budget, look at Obama's budget, and look at Trump's budget. You will not see a big difference. You might see some differences in social policies, but not in those budgets. Matter of fact, specifically, look at the Pentagon budget for all three. You will not see a difference, except you'll see higher than Bush's and Trump's is higher than Barack. I'm telling you, it is capitalism. It is a racist system, and we fight against racism and should. But racism is the ideological companion of capitalism. There is no system called racism. The system is capitalism. So unless we get our people to fight racism by defeating capitalism, we're going to be in this kind of madness for some time to come. This is why I put a lot of emphasis on systemic change. Martin Luther King, later years, said we need a revolution of values. We need a radical rearrangement of the entire social, political, economic order. And we have to do that. But in the meantime, if you do what Inez and I did, we stopped gentrification. We're getting our people jobs. We're building up the infrastructure, built a whole new youth center, 3 new schools. All of that can happen in the meantime. And while you address that material needs for our people, raise their political, ideological consciousness for revolution.
Charles, you sound like the same Charles as of 4 or 5 weeks ago. We spoke with you when you were in the
I'm angry. I'm angry.
I know.
I'm more angry.
I hear that. I guess you're back again, huh? You well. Almost 100%, you say, right?
Oh, yeah. I can't wait till this is over. Oh, my God.
Yeah.
Welcome back, both of you.
Yeah. Is Inez still on the line? Is she still with us?
Yeah.
Oh, she is. Okay. Councilwoman Barron, one thing I definitely wanted to ask you, we've been doing some stories we've been seeing in the news about the education aspect. I know you yourself are a former educator. What's your reaction to what's going on with the public schools? You know, the mayor and the governor are kind of at a tug of war right now with the closure of the schools. But what is your reaction to the remote learning and what's going on in our school system right now?
It is severely ineffective. There's still about a quarter of the students of the population of students who have not received their devices. And of those who have received them, there's still challenges with the access and being able to use them. The problems are manifestation of the long-standing inequity in funding for our Black and Brown communities. Goes beyond what it was even for the case where we talked about we were inequitably funded for all those many years, and still has not been resolved because the governor has refused to give money that would be mandated as a settlement from the courts have mandated the city. We have not received that. So what we're finding is that we got caught, as with all agencies, unprepared for a situation of this magnitude. There had not been any planning that this kind of tragedy and injustice and pandemic would face us and bring us to this point. So we have schools that really didn't even have a database that how many children did not have any electronic devices. They had to piece that together. And in piecing that together, They came up with a plan. Well, let's make sure that we can get them into the hands of those who are most needy. I've been told, however, though, that there's not one device per child. Okay. So if you have a household with 5 children, you may have 2 devices, but you've got 5 children who are supposed to be getting a full day's instruction who can't because they only have 2 devices in their house. So that's a problem in itself. The other thing is that teachers were thrust. Now, I was a teacher. Teaching is my love. That's my gift. That's my calling. Right. And teachers were thrust into trying to adapt to this modality. And I've been told that the new distance learning is, in fact, somewhat related to some of the technology that had been brought in, totally foreign to the teachers, and that's a good thing. But to have a whole day's lessons required to be taught digitally, remotely, is a challenge. How do you give a 5-year-old who would be in a kindergarten class engaged in so many activities the instructions over a remote device? Or, we have the pre-K, we have the 4K. How do you do that and expect a child to be? And so it's a great challenge. The institutions are going to be greatly changed after this. We're going to have to sit down and face it. We got to make sure that we use this to demand and to call for and to make sure that we get our fair share, not just with the education, but with housing, with the health care. That's always been a disparity. Now is the time for us to look at that federal money coming in. The problem is it comes in as a block grant, I believe. So then the states have the ability to divvy it up. We got to make sure that we get that money so that we get health care dollars pulled out of that to come to our communities, because there's no equality if everybody gets the same amount. And we, from the outset, have been underserved and underserved. So we can't still get $1,000 per person when every other community is getting, let's say, $1,000 per person. No, we need to get 4 and 5 to bring us up to that level where other people are already at.
I think what we're hearing, Ms. Barron, is that people should stay vigilant even in this crisis, and even other things being thrown at us and we're being distracted and all of that. We have to remain vigilant and somewhat activist in mindset to make sure that when we get pulled through this, we on the other side, we've got a mental note, if not a written note, of what we need to ask for or demand. as the money's divvied up and as changes are made going into hopefully the fall, do you think school will be open before the fall or no?
That's a good question. Yeah.
I think schools will hopefully be open by the fall. Before the fall, I can't see that. We only have approximately 10 weeks left before the end of the school year, which means that you would have to say that you believe that in 2 weeks' time or 3 weeks' time, we will have gotten over this and we are ready to open schools and leave 7 more weeks of instruction. God forbid that happens and a child or a staff member or a worker in a school gets diagnosed with the virus. That means that school would then have to be shut down and all of those children sent back home. There's so many factors of what could possibly happen. You certainly wouldn't be practicing social distancing if you open schools. You could have children sitting next to each other, less than a foot apart. So you certainly would not be continuing to implement social distancing if you open schools within the next 3 and 4 weeks.
Okay.
All right.
So have we lost a year, half a year of learning? And how do we catch up in the fall with that? You know, for children who are in the critical time of learning new skills and new knowledge. How do you catch up for the next term?
That's going to be a great challenge for Carranza and his staff and the cooperation and support of the teachers union and the principals union. That's going to be a great challenge. What are we going to do to make up for this 6-month lag? Because it will be from February, March, April, May, June. And so we've got to have a 5-6 month lag. How are we going to compensate for that? Perhaps it means we need to do another type of instructional day, how we structure the day for children to be able to compensate. Because remember, there are children who are already now behind for 3 weeks because every child has not received a device. So those children who have not are already at a disadvantage of at least 3 weeks. So it's going to take a lot of creative thinking and a lot of restructuring as we start the new school year, hopefully in September.
Okay. Assemblyman Barron, I wanted to ask you a quick question about the stimulus check that is going out there. Reports say that some of them already have been doled out. Some of them have been deposited into accounts. What's your reaction to the stimulus checks that are going out?
Well, first of all, a lot of those stimulus checks that are going out are not coming to our neighborhoods. For instance, a lot of the money, and Viola Plummer and Karan Allen, we've been really looking at how is the money, the stimulus checks for $1,200, the stimulus checks for the businesses, they're not reaching our people, and especially not in a timely sense. Like take the businesses. A lot of the businesses in our communities are not connected to banks that are participating in this. So when they go to try to get that $10 million loan or whatever the amount of loan that they could use for their staffing and for paying their rent, they're getting rejected. Or it's an encompassing process, so they got to call a small business administration, and Viola and Karan is giving them information on that to make sure that our businesses get money. So no matter what they do in Washington, like I understand now, they're talking about another $250 billion for small businesses, but some of our legislators are fighting for $125 billion of that to be earmarked for our communities, small businesses in our communities, mom and pop stores, so-called minority and woman-owned business. So accessing the money has been a real problem. And also, I think on a federal level, come on now, $1,200 one-shot deal? No, they should be $1,200 a month for the duration of the pandemic, not one-shot deal. You know, you get $1,200, that ain't even paying the rent for some people.
Right, exactly.
And then they had the fight to extend the unemployment system, but for 4 months, but to extend it even further. Because at least now they are giving you get about a third of your money anyway, and now they're adding another $600 to it. So that makes it a little better. But these things, their whole system is jammed.
Right.
So it's been so many people unemployed. We getting calls in my office, and they're saying, how do I access my unemployment benefits? How do I tell them that you have to stay on the line? You have to keep calling, because if you get impatient and hang up, you're really never going to get it. So you better stay on the line, no matter how long it takes you to get it. These are the things that, racism and exploitative capitalism causes in our communities. And this is what we have to fight hard for, to make sure that whatever happens on a federal and state level, communities.
Okay. No, but did you have something else you wanted to ask? I got to wrap up.
No, I know they have to go, and I'm really grateful to spend so much time with it. What would you say to the community, Assemblyman Barron and Councilwoman Barron, as they sit and listen to this, and some of them may be very frustrated and very anxious? What would you say in terms of encouragement to stay the course and come out on the other side of this stronger than, as you sound strong, the pair of you sound really strong and even more invigorated? How would you advise the community to be such?
Well, I would encourage our people to, number one, try to think positive and keep your house as positive as you can. Have more tolerance for each other. Learn how to love and enjoy each other. And most houses do have TVs. You do have books to read, and many people have computers. And get creative. Get creative and having fun with your family, number one. Number two, make a commitment. Get creative and make a commitment to our struggle for liberation, so that when this is over with, and this too will pass eventually, when this is over with, we got to struggle against this system that puts us in bad shape for when these kinds of things happen. And then finally, look out for one another. Stay in the house. Don't go out, because you can affect somebody else, or somebody can affect you. You need to stay in the house. This is serious. People are dying. This is very serious. My brother, and it hurt me so much, Minister Abdul Hafiz Muhammad of the Nation of Islam, we lost him. Yeah. We lost him, and it can happen to any one of us. A couple of people from my district called me, and they said, you know what? We didn't think this was for black people.
Forward.
Everybody said, hey, we better take this serious. So if there's anything good about me being affected earlier and it being in the news and on TV, it served that purpose for some of the people in my community, because now they took it more seriously, now that the blackest person they know has been affected. So they are now taking it much more seriously. So to mobilize, to raise our consciousness, and make a real long-range commitment to our liberation and revolution.
And I would just add to that, go to your source of strength, whatever that is, whatever your spiritual or religious source of strength is, go deep into that source of strength. And that means that you need to touch with those prayer warriors or spiritual people that you know, and whatever means you want to do that, or read those inspirational books that you have, do that. Draw on talking to those people who are positive, who reinforce what your beliefs are, that can help get you through. And then maybe you want to develop a new hobby. Maybe you've got something in your house. You may not have the materials that you might need to develop a hobby, but you can certainly go, those of us who have, go to YouTube. You can find out how to do it. Open up the elbow underneath my sink, and get my drain opener and put the auger in and swish it around and pull out whatever's clogging up my drain. I've got lots of information. So I now know how to. Just call me Plumber Inez. But there's lots of opportunities to be able to. And, I've also said, people can do their own biopics.
Right.
Write your own story. Tell your own story.
Absolutely.
Record it, write it down. Most of us have these devices where we can do voice memos. It's an opportunity to develop your own self and if you have a hobby that you've been trying to get started and you have the materials in the closet or in that drawer that you just haven't gotten to, now's a good time for that. But find ways to keep yourself grounded, keep yourself stable, keep yourself calm in the midst of all this that's swirling about us.
All right.
I think it's so important to have you two in the media the way you are, and have you to speak to our community the way you have, to be inspired by you. Because as you said, Charles, some people didn't believe that it could come to us, and then to see you and to rebound the way you did, and to speak to us while you were in the midst of it, and tell us, stay in the house.
Yeah.
Diagnosis. Days, stay in the house. You're saying what you've lived, not what you just think. You're living it. You're telling us, you're advising us as you're in the middle of it. So we want to thank you for giving us this time.
Absolutely.
And sharing us the knowledge again, as you always do, and your experiences. We appreciate you. Thank you so much.
Yes, thank you.
Thank you.
That concludes this week's podcast. You can pick up the latest edition of the New York Amsterdam News on newsstands and get updates online at amsterdamnews.com. You can also keep up with us on Facebook at NY Amsterdam News and follow us on Twitter at NYAmNews. I'm Cyril Josh Barker. Thanks for listening. The coronavirus crisis has brought serious distress to local economies and advertising along with them. The New York Amsterdam News has partnered with the local media association during this unprecedented crisis. Help us continue our important work of chronicling the life of blacks in New York and consider making a donation to the COVID-19 Local News Fund. Go to givebutter.com/Amsterdam News to donate.